Good evening, everyone. Welcome back to the 9th virtual Palm Beach International Equestrian Center educational series presented by Adequan here at the Winter Equestrian Festival for week 9. My name is Miranda Tiona, and I am your returning host and educational series coordinator here for the 2021 season. We have 4 more weeks remaining to learn together every Thursday at 6 p.m. Eastern Standard Time. Again, another exceptional turnout last week with viewers joining from all over the world and continental United States. Your participation in the series is most appreciated. It's because of you. Thank you. Now, throughout the session, to engage virtually with us, but most importantly, to engage with the speakers, please utilize the Q&A message center at the bottom of your screen. You should see a small icon that says Q&A. Please note the chat is disabled. The Q&A is the only way to engage with us. So please utilize that. You can also ask questions at any time during the session. It will not disturb the presentation at all in any way by the speakers, and we love interaction, so please send your questions. Lastly, I would like to say a huge thank you to Karina Brez Jewelry for providing a luxury item for our grand prize giveaway, which is a limited edition light pink diamond 18-karat rose gold horseshoe necklace valued at $3,000. How it works. For every session that you attend, we can see the stats. You will get 1 entry, and the winner will be announced April 1st, our very last session together. You don't have to be present to be on that webinar to win. We will simply be emailing you with the email that you registered with, so hope you check it. All right, now with all that said, let's begin. I am delighted to introduce today's topic and speakers. Today's educational series session is sponsored by Bemer, and the topic is Bemer horse set research findings, benefits on general anesthesia. The Bemer horse set is known throughout the equestrian industry for their revolutionary technology, helping horses to recover and perform their best. This year, Bemer is happy to provide research findings on the benefits of the Bemer horse set usage on horses that have undergone surgical procedures and are looking to return to competition top shape sooner than ever before. Bemer North America is a subsidiary of Bemer International AG, a leading global medical device company specializing in the research and development of microcirculation products for both humans and horses. Founded in 1998, Bemer now operates in over 40 countries. Bemer is a leading innovator in physical vascular therapy technology and holds FDA Class II and Health Canada clearances, along with numerous technology patents. We have 2 excellent speakers for you today. Our first speaker is Dr. Joshua Burka, who is a naturopathic medical doctor who is versed in both Eastern and Western medicine. His interest in a world beyond biochemistry and drugs led him to the field of biophysics and related therapeutic modalities that innovate modern medicine. Dr. Burka has become an expert in many biophysical therapeutic applications, including pulsed electromagnetic field therapy, PEMF. 13 years ago, in his global exploration of the most researched and effective PEMF device on the market, he discovered bioelectromagnetic energy regulation, Bemer, while vetting an array of products that deploy PEMF. Bemer technology not only made logical sense, but the safety and efficacy of the product had also already been scientifically proven. Bemer is unique from any other biophysical modality on the market in that it directly positively influences the most functional aspect of the cardiovascular system, that being microcirculation. Dr. Burka is involved with the research and development of the Bemer product and the advancement of the technology for use on Earth and in space. Dr. Joshua Burka has served as a medical consultant for Bemer USA for 12 years. Our next speaker is Dr. Olivier Brandenberger, who is a veterinary surgeon originating from Switzerland. He graduated from Bern University in 2011 and afterwards performed an internship and residency at Grosbois Clinic in Paris under the supervision of Dr. Rossignol. In 2018, he received his diploma from the European College of Veterinary Surgery. Currently, he is one of 3 partners at the Hansa Clinic for horses in northern Germany and is responsible for the surgical section of the clinic. He is married to Amadine, who is also a veterinarian, and she performs the anesthesia of his surgical patients, and both are owners of 5 warm-blood horses for show jumping. I'd like to thank both of our speakers for being here today, but I'd like to emphasize Dr. Brandenberger is actually joining us from Europe, and it is midnight his time. So let's hope he's had plenty of coffee. So let's give him an extra special welcome for staying up with us so late. And of course, to Dr. Joshua Burka, who are also very excited to have as well. So I will now, without further ado, I will welcome our very first speaker of the day, Dr. Joshua Burka, to turn on his camera, unmute himself, and begin his very excellent presentation. Thank you all very much.
Thank you so much, Miranda, for a fabulous introduction. Please do let me share my screen here and we'll get this going. All right, everything is good. So thanks again for having me. I'm going to flip through this. I am Dr. Joshua Burka. I've been a medical consultant for Bemer for over the past decade, 12 years or so. And I want to appreciate each and every one of you for being here today. At Bemer, we research and develop treatment options for both humans and animals, more so from the equine market. And our devices, they are designed as vascular therapies to improve blood flow and support the self-regulation of blood flow within the smallest vessels, that is the microcirculation. This results in more adequate blood circulation and distribution effectively to support the entire vascular system, not just the microcirculation, but that as a whole. Bemer's slogan is better circulation, better health, better life. People and horses do have a very unique bond, and we respond to each other. And Bemer takes that into account. They didn't just make a device without consulting the veterinarians. Many veterinarians, physicians, horse enthusiasts, and riders alike have adopted Bemer therapy or the Bemer horse set to support both performance, recovery, and regeneration for their animal. We say it's made for riders and loved by horses. Doesn't matter whether you're a jumper, dressage, eventing, regardless of where you're in professionally or recreationally, Bemer has a place for you both on the human side as well on the horse side. I used to own horses growing up myself. I wouldn't say that I'm an equine enthusiast at this point in time, but I am because of Bemer. And it's important to keep them healthy, to feed them properly, to support the regeneration and ensure proper performance, mitigate or limit stress or help them respond or recover to stress naturally, as well as the equipment and the gear and the tack that it takes to keep your horses in good health. There's a lot of challenges, as you all know, to owning a horse, to supporting them in their best health and wellness. They tend to be stressed. If they, for instance, we know that horses are prey animals. And so when we look at this, they have a good startle response. I call this relaxed readiness. They are relaxed, but at the same time, their nervous system is tuned to be able to go in any direction at any time. They can have a decreased adaptation to exercise or not connecting with the rider, even resistance to the rider. Digestive problems are also very common in horses. And that sometimes can have muscle tension in the musculoskeletal system, which has a direct effect on performance, as well as degenerative diseases, as well as acute and chronic illnesses. Injuries are happening all the time, especially for your equine friends who are in the performance world. Skin issues, musculoskeletal issues, soft tissue traumas. It's not just the trauma. Sometimes they go out and perform too quickly and they never heal completely from those injuries. The microcirculation in a horse and the microcirculation in a human is really not that different. We're more similar than we are different. And it's because of how the nervous system interacts with that unique aspect of controlling the micro pulsations at the smallest level of the vessels. Poor blood flow, and again, this isn't something that you might see clinically so much. It's subclinical. It can lead to impaired cellular metabolism, restricted organ function, and decreased self-regulatory mechanisms. You'll hear me talking about this today, this autonomic regulation, parasympathetic, sympathetic. The ultimate or the optimal function of the tissue has to depend on how blood flow is moving. Are tissues perfused? Are they not perfused? As well as waste products, metabolic waste products being removed from these tissues. Poor blood flow also causes a variety of health problems, decreased energy, performance, impaired healing, post-trauma, insufficient regeneration, as well as susceptibility to infection. And like I said before, that delayed wound healing. The horse's circulation and a human circulation, while it may operate similarly, I mean, the horse's heart is not the same, the amount of blood, and depending on the size of the horse, we're talking 30 to 55 liters for Canadian European folks, and between 8 and 15 gallons of blood that's being pumped through that body all the time. And it's not just through these vessels that you see, that where you do venipuncture and you're injecting. Over 3/4 of the body, both humans and horses, are directly related to the microvessels. That means those vessels less than a couple hundred microns. You can see as an example here on that left side, this is a human heart. You can see an angiogram. These are 500 nanometers or larger vessels. This is where we go in and look at with angiograms. And when you look to the right side, this is both the macro and the micro. Look at all those micro vessels. Like I said, more than 3/4 of the microcirculation makes up the entire vascular system. Pretty impressive. For those of you who are healthcare practitioners, every one of us was taught in school that this heart in the center of our chest or in our horse's chest is pumping the blood through the body. And I used to believe that, but now the more I understand microcirculation, vascular flow, hemodynamics, both macro and micro hemodynamics, that's absurd. There's no possibility that this heart can pump all the blood through that horse's body, thousands of gallons, alone. It does pump, but the micro pump, the micro pulsations are key here. And these micro pulsations are controlled or modulated by smooth muscles. And these smooth muscles, you can see on the left side, when they're relaxed, blood flows and more blood moves. When they're constricted, it impairs the blood flow. And this is important because you have to shunt that blood to areas of metabolic need. All blood can't flow full speed and around the whole body at the during the whole time. So it shunts blood as needed. Blood comes in, as you can see on the left, from the arterioles, starting with large caliber precapillary to small capillary. The capillary network is where this exchange happens. Metabolic wastes are removed and nutrients are delivered, or maybe in the opposite manner. And then they're cleared through the veins and venules back through the heart lungs. Take a look at this, because our vessels are not just stagnant pipes. Microcirculation is the smallest vessels, but it's these vasomotor functions. This is not in a horse, this is in a human being, but this is real time, what's called spontaneous vasomotion, taking images through intravital microscopy. Not only do these vessels have the capacity to oscillate, they can actually reverse and change blood flow. These oscillations are called vasomotion, and vasomotor function is in charge of moving blood where it needs to go based on metabolic needs, independent of the heart rate, independent of the respiratory rate. You can even see in this image here, as the blood is flowing and they start to constrict, it will change the rate and rhythm of that flow pattern, both flow motion and vasomotion, and even reverse the blood flow. You can see it happening right here, ladies and gentlemen. So I want to flip from this and really look at something beyond vasomotion and talk about flow motion. It's not just the vessels that are opening and closing, it's the blood that's pumping and moving. Our blood does not move like a hose in a laminar fashion. It's pumped and it slows down. It's pumped and moves and slows down because it needs to drop off oxygen. It needs to drop off nutrients and then pick up waste products, rather drop clear waste products in that way. So this is called flow motion. And don't just take it from my perspective or from my mouth. This is straight from the horse's mouth. Healthy circulation is the horsepower for health. How do we treat impaired vasomotion? You don't do it with drugs. You don't do it with surgical intervention. There are no conventional medical treatments that have a direct effect on vasomotor function. This requires a true biophysical stimulation. And that biophysical stimulation is very unique. And it's not all systems like you're seeing here that emit a pulsed electromagnetic field like Bemer that have this effect. Bemer's waveform and signal are the active ingredients that yield to the positive results that equine experts and riders have also come to know as well as trust. I said no other PMF device has demonstrated this scientific research and clinical results with respect to improving circulation like Bemer. Point. Period. That's the end. There are other products out there that also use PMF, but they do not influence the body, the horse's body, in a neurovascular interactive way like Bemer therapy. How does this work? The electromagnetic field is pulsed through the applicators, the blankets or the cuff. It has a direct effect on the musculature, all cells and tissue, and it influences the blood vessels. When you get inside the vessel, you can see the changes of how both vasomotion occurs and flow motion. You can't see the coils here, but Dr. Brandenberger will show you a picture of them. These weren't just placed for kicks, for fun. There are 19 coils, 3 coils on each of the cuffs, totaling 25. And these coils in the blanket have a direct interrelationship where these nervous or nerval plexuses are located. So there's a direct influence on the nervous system, and we can see the great effects on the neurological or balancing of the nervous system. This is actually intravital microscopy in the distal area colon of the horse, and you can see the difference in changes between before using the Bemer and after. And no, this isn't just sped up video. Bemer even works not just when it's on the horse, the effects extend even after the field is pulled away. It's almost like a somatic re-education supporting the autonomic regulatory factors that ensure healthy blood flow. Bemer is very easy to use. It has a very wide therapeutic window. You have choices of 3 programs, program 1, 2, or 3, 5, 10, or 15 minutes respectively, with maximum average flux density on the blanket up to 35 microtesla and on the cuffs up to 100 microtesla. So very, very effective, and not a high power is not needed for this because Bemer really depends on the information that's being delivered to influence physiological processes, specifically microcirculation. Equine therapy, Bemer equine therapy, how's it benefit? Health. The overall health is supported through functional circulation. If you're not in the flow, you are not in good health. That's a simple fact, whether you're a human or an animal. By enhancing blood flow, you have good improved delivery of nutrients and removal of waste products. In sports, it's a requirement, it's a requirement that your horse is able to focus, is able to be supple if you're in a event where you're riding, supporting endurance, strength, and most importantly, there's no way a horse can perform unless they recover. And so it's this balance of performing, training, recovering that allows for this ultimate aspect of being at one's highest performance. Rehab. I've looked at humans and I've looked at horses, and rehabilitation with Bemer is exquisite, sometimes in half the amount of time. There's accelerated recovery, enhanced regeneration processes, as well as the support of this parasympathetic activity that's crucial and vital to the healing process. You must be able to move into a relaxed position to actually move into that healing mechanism, moderating and modulating inflammation, This supports resiliency, which folds into prevention, which we'll get to, and avoids further injury, which we see so many times in horses who are pre-injured. Maybe they're getting a corticosteroid injection, getting back up there, and they're staying in a low-grade inflammatory state, setting them up potentially for future injuries. Prevention is my favorite area. And when you're perfused, you're protected. And the blood flow that's moving supports your immune system. This improves ATP, energy production, and not just stress relief, but supporting resiliency, that ability to interact with the physical world around a horse and respond appropriately versus react. This is autonomic balance between parasympathetic, sympathetic, and this is supported by Bemer, the self-regulatory processes. Bemer encourages relaxation of the recovery process as a review, helps to prevent anxiety and stress, increasing performance, supporting training exercises and suppleness, that connection with the rider, improving defense against affection, promoting regeneration, which follows exertion. You have to recover to perform, and it aids in the healing mechanisms following injuries. Also to note, has a very positive impact on anesthesia procedures and regeneration following surgery, which Dr. Brandenberger will certainly speak about. On that note, I would like to introduce, Dr. Brandenberger was already introduced, and I want to thank you, Dr. Brandenberger, for being here today. And I will share it over to you.
Hello, everybody. Thank you very much, Joshua, for this kind introduction and this absolutely beautiful speech, which explains a lot. And I would like to go on. I like to thank also for the invitation to share our experience of the Bemer horse therapy, which we use during general anesthesia in horses. So we can go one slide further. So I would like to share this talk. We start first why we have a lot of surgeries in northern Germany, and when we have a lot of surgeries, I mean we have a lot of general anesthesias. Just to give you a little update of why that's the point, and then also talk about the challenges of general anesthesia in horses. I assume that a lot of you have already had a horse in general anesthesia, and I would like to share a little bit the difficulties of this of these horses, and then I would like to share why and how we use the Bemer horse set during general anesthesia, after general anesthesia, and also what's ahead in the future. So just to a very short, brief update of our clinic. This is in northern Germany. We have a clinic in the middle of 3 large breeding areas, which you might know, the Hanoverian, the Oldenburger, and the Holsteiner horses. There's a lot of young horses, and these young horses, they need surgeries, either for the articulations or for the castrations, or as we have in our clinic, we're specialized on eye surgery, so ophthalmology. We have a lot of horses that have eye problems, and also, which is more my field of interest, larynx surgeries, which throat surgeries on these young surgeries. So we do approximately 1,000 horses, 1,000 general anesthesias a year. Then we can go on. And the interesting part about this is that we have a specialist of ophthalmology in our clinic, and he performs around 300 vitrectomies per year. Vitrectomy is a surgery that is used in horses that have equine recurrent uveitis, which means they have an infection or have an inflammation because of leptospira in the eye, and the surgery consists of flushing out these inflammation products of the posterior chamber of the eye. And in our clinic, it's always the same surgeon, it's always the same nurse, it's always the same assistant, the same anesthetist, which gives for these 300 surgeries quite a unique and uniform setting. And this is also something that we need when we do studies, that we have a uniform, unique setting. So this was a perfect condition to study the Bemer effects. The problem with the general anesthesia is, and I think, as I already said, a lot of you have already had experience with their horses being put under general anesthesia, and the doctors will have explained to you that the horses, when they get the medications for the general anesthesia, they suffer from cardiovascular depression, which means that their blood pressure goes down. And when the blood pressure goes down, the blood is in the periphery, is not flowing very well. And this is not good for the muscular circulation, which means the muscles, they don't get enough oxygen, so they suffer also from hypoxemia. On the other hand, if you have general anesthesia and the horses, they have to get up after general anesthesia. Everyone is afraid of that, the recovery of the horses. The recovery phase can be quite violent. First of all, because the horse is an animal that wants to go away when he's afraid. And there, one point is very important, that is the anesthetist. And the anesthetist, he has to make sure that the horse gets not in a too deep of a plane of anesthesia, which means if he gets too much medications during the general anesthesia, he's more likely to have a violent recovery. So the anesthetist can influence this quite a lot and try to make a balanced anesthesia in order that the horse gets up nice after surgery. Then one thing that is very important, and I put a nice picture of a very large horse we had currently for an articular surgery. You can see how this horse, when it's lying on its back, all the muscles of the back are completely compressed. And in this case, it were like 850 kilograms, putting pressure on these muscles. And when there's pressure on these muscles, the vessels are also compressed and they don't get enough flow. So these muscles, they don't get enough blood, they don't get enough oxygen, and also the waste products are not put away. And this is, we can go to the next slide. Oh, I already said about the eventful recoveries. There were two pictures what can happen, and no one wants that. So we try to improve the general anesthesia. You can go to the next one, that's okay. And what are the ideas? What are the areas for improvement? So first of all, avoid general anesthesia. So we try to do a lot of standing surgeries. And on the left, you can see I'm doing a larynx surgery, a throat surgery of the horse. And this is performed on the standing horse, if the horse is willing to do that, just with a sedation. This for sure avoids a lot of complications from the general anesthesia. But for example, in the ophthalmology field, where this is called so-called microsurgery, where the surgeon has to be very precise and the eye has not to move at all during surgery, this is not possible to be performed standing. So we have to figure out another idea. And on the right, you can see it's actually my wife doing assisted recovery of a horse. So with the ropes, we try to guide them after surgery. This was a fractured limb. You can see the leg there. And these horses, we try to guide them with the ropes, but this is also not so easy because we have a lot of young horses, and the young horses, they can get afraid of the ropes. And once they're up, and they start to get afraid, and they start to run around, and they can also hurt themselves because they have ropes attached to the head and to the tail. So this is not always possible to perform an assisted recovery. So, and then we can go to the next slide. We were thinking about going on, so finding other solutions to help the horses during general anesthesia, and we came out with the Bemer horse therapy, because, and as Dr. Burka explained very nicely, it increases the microcirculation, and this is what we want during surgery. We want that the horses, they have a good blood flow in the peripheric field. So we wanted to see, and we also used it because of that the microcirculation is enhanced during general anesthesia in the horse. So this is how we do this. We, on the left side, you can see that we also use invasive blood pressure to check the blood pressures, and then we, on the right side, you can see how we put the blankets on the horses during general anesthesia in order, especially for the muscles, to get these muscles nicely with a nice blood flow. And you can also put the horse on the blanket, so the blanket is actually stable enough that you can put the horse, first the blanket on the table and then the horse on top, so that the underlying muscles, they are also more, they also get more microcirculation and are stimulated. So what we did in our clinic, we did a study, which is a placebo-controlled study, which is double-blinded, which means we had two groups of horses that we used for vitrectomy surgery, normal client horses, and we put the blanket on. We had, as I said, two groups, one with a functional blanket and one with a non-functional blanket. And in this publication, we figured out all the effects on the blood pressure, on the muscle enzymes, on the lactate, on the recovery. And this is what the results we will publish in a study that for the moment is under review. This is always difficult to say how long it takes, this review. I would say until summer, I think we should get it published, that you can read all the results there in detail. So after this study, after we have done this study, we started to use the Bemer horse set for the general anesthesia in a routine fashion. And we do this before, during, and after general anesthesia. We start before general anesthesia to calm the horses down, to make them a little bit like sedated. You all know the effect if you have already used the Bemer horse therapy on a standing horse. They like this, they get settled, they get a bit calmer. We have a lot of young stallions that we have to do the surgery on, and this helps them to get ready for the surgery. Then, as I already have shown, we use it during general anesthesia to improve the microcirculation that is diminished with the isoflurane medications. And we also use it after general anesthesia to get all the waste products out, to get all the toxins out. And for example, on the right side, you can see a horse I did surgery on approximately 10 days ago. This was a horse that was with the rider. He fell down a bridge about 3 meters down into a hole, and he couldn't come out, and so he was struggling a lot. They had to get the fire department to hoover him out. So this horse, when it arrived at the clinic, he had already sore muscles, started to have a myositis, and he had a large wound here on the forearm. You can see the bandage there, with also a ruptured artery. So we had to put him in general anesthesia, even though he was not in a good state to be in general anesthesia. I sutured the whole limb. We used the blanket during the surgery, and we used it during recovery. And I was very afraid that this horse would not get up because of all the muscles that had already been damaged. And when horses get a myositis, they get like in a toxic state, and they can not recover from general anesthesia. It got up very well. I was very happy, and the wound is healing quite well for the moment. So as a conclusion, I think one important feature is that what we saw when we did the study, and also what we see when we do the daily use of the blanket, that the Bemer horse therapy helps during the general anesthesia to improve microcirculation. And for this, you have to pay attention. When you're a vet, you have to tell your anesthetist, please reduce the dose of medication, the dose of medicaments that you give, because as it is more circulating, the horses get quickly into a deeper plane of anesthesia. So pay attention to that, which is good, because then the anesthetist can get a lighter and more balanced anesthesia with less medications, and therefore, as you can see on the right picture, the horse stands up in a nice fashioned way. I put some references on and to show which you can read up if you want to, from which I learned a lot, because I was quite critical before we started to use it, and now we use it on a daily basis. I'm really happy with the effect of the Bemer horse therapy during our general anesthesia. I'm really happy to ask questions. I hope you have a lot of questions.
Hi, Dr. Brandenberger. So yeah, we do have Dr. Vonk. She's a veterinarian. She will be moderating some of the questions that are coming in. But one of the questions that I had, was there any issues when you're using Bemer during anesthesia with regulating objective measurements or changes like heart rate, blood pressure, or were you able to compensate the changes with Bemer with dosage fairly easily?
So you cannot see when you put on the blanket that, for example, the changing of the blood pressure is immediately. You cannot see stuff like that. It's more subtle. It's more subtle. It's like the treatment. The treatment is also more subtle. So it's just a general effect on the whole horse. So the anesthetist will not scream out, "Oh my God, what's happening?" when he puts on the blanket. Actually, it just goes on, but you have to tell him to reduce the doses and maybe reduce the isoflurane intake of the horse, because it helps the horse to get the medications in the circulation.
Yeah, that's great. We see this also in the human side, supporting the bioavailability and or delivery of either nutraceuticals and or pharmaceuticals to the target tissue. So thank you for that.
Yeah.
Dr. Vonk, do you have any questions that are relevant that you could either ask myself or Dr. Brandenberger from the folks in the audience?
Yes, there is a lot of questions coming. I can't keep up with it at the moment. Amazing presentation, Dr. Brandenberger and Dr. Burka. Thank you so much. Wonderful. One question here that I saw that you may be able to answer, Dr. Brandenberger. What settings were used and how often are you using it more specifically?
Oh yes, I didn't precise this in the presentation. So we use it on the third setting during general anesthesia, which is the strongest setting, and we use it for 15 minutes. And same in the recovery box, in the recovery stall, we put on in the third setting, and again around 50 minutes. Anyway, you have to move afterwards because the horse wants to get up.
This sounds like a question for Dr. Burka. Can you please explain the difference between vasomotion and flow motion?
I sure will. And you can't tease them away. It's like flour and water. The fact is, vasomotion is the autorhythmical pulsations which are modulated and mediated by the nervous system and endothelial nitric oxide. So the nervous system, alpha beta receptors, squeeze the vessels down and open and close them, as well as the endothelial cells are releasing nitric oxide to vasodilate. And it's this yin yang, or this balance, that controls these oscillatory rhythms called vasomotion. So that's the structure itself. The function is actually the fluid movement through and how that's flowing, whether it's laminar flow is just continuous flow, which the body doesn't do, but pulsation. So flow motion is the pulsatory movement of blood. Vasomotion is the autorhythmical movement of the vessels. I hope that was helpful.
Dr. Brandenberger, what is the effect of anesthesia, particular general anesthesia, on the circulation, and how specifically does or made with Bemer help with that?
That's a good question. That's if I have to answer this, it takes a long time. I think the imminent effect is that the blood is more flowing, and on some horses we saw that the blood pressure went up, and on some horses we saw that the blood pressure went down. It's also very, very, very individual, I think, when you use the blanket. It depends on what kind of horses you're doing, and also I think what time during the surgery you're using it. There's always a phase where the horse gets down into an adequate plane of anesthesia, and afterwards you start the surgery, and there's painful stimuli when we start to cut or when we suture at the end. So it depends also at what time you use it. We tried to use it in the most, let's say, violent time when there is a lot of stimulation, that this also interacts with the blood pressure, for example, and then maybe the Bemer blanket helps to counteract these effects.
Dr. Brandenberger, are horses more relaxed during their hospital stay? Are you actually utilizing the Bemer horse set on the horses that are hospitalized to begin with for other cases as well, not specific to surgery? And how does that affect them if you do?
We use it on a daily basis also, before and after surgery, and we bill it for the owners. If they want it, they can use it, but we make them a bill because it takes time of a nurse to perform, to go there, put the blanket on. And a lot of people, they want that, they pay for that in our clinic, especially. So, which means also that because they know their horses, they seem to think that it helps the horses also to be more relaxed in the clinic.
Dr. Brandenberger or Dr. Burka, what schedule of regular use would you recommend for a performance horse for overall wellness, where no injury is yet hopefully not present?
I'll start with that. And again, it's very similar to the human. If somebody is a horse or an owner is trying to keep their horse toned up, from a wellness perspective, the recommendation is daily use, sometimes even BID twice a day. And depending on the situation, whether it's a horse that maybe is a racehorse, maybe you'll use higher levels versus maybe a horse that's just recreational, you might use the lower levels, the program 1. And so, yeah, just for upkeep, once or twice a day, but maybe more often if they're in transit, if they've just performed, if they have just trained doing some exercise or something like that, then you'll maybe use it after that. And I use it more after the performance to support the recovery regeneration phase. I said it early in the presentation, you can't perform unless you recover. And so that is usually that area where it's lacking a bit. And it also supports to regulate that, or self-regulate the autonomic nervous system.
Dr. Brandenberger, there are a lot of questions about specific usage. Did you want to comment on the usage as well?
Yes, I wanted to say what I can see with owners in our stable, for example, when they often put the blanket on when they are preparing the horse, when they're mucking out the box or something like that. The horse is standing there and has the blanket on. So I think you can use it really good on a daily basis.
Dr. Brandenberger, there are a lot of questions about specific usage on specific injuries, different joints, different leg conditions. Can you comment on how, if you are already utilizing the Bemer more therapeutically, specifically also in conjunction with the cuffs in those injured horses that whether they have surgery or not, but they have to recover from their condition?
I can tell you for the surgery. So we have clients that have the Bemer horse set, and after surgery they use it on the operated legs, for example, after joint surgeries or after tendon surgeries. We have a lot of horses that have problems with the annular ligament, when I cut the annular ligament, and they use this, I don't know what's the word in English, this gamasche, this boot, and I can only recommend it. Absolutely.
Dr. Brandenberger, there was a question about how did you ensure that this study was done double blinds?
Yes, very nice question. So we had 2 groups of horses, and we had a list of 100 horses, 100 places, and we threw a dice before every surgery if the horse went in group A or went in group B. And we prepared the list, and then we started, or we went on with the surgeries. And during the surgery, we had young vet who is doing his thesis, and he put on the blankets on the horses, which were marked with group A and group B. And the guys from Bemer, at the beginning of the study, they came to our place and they modulated one of the blankets from group A or group B, we didn't know, and they took out a little piece, so it wasn't working. But from the outside, when you put on, the light was still going up, so it looked like a normal blanket. So our team, the guy who did the thesis on, he didn't know anything about which was really the working blanket. We just put it on, and we got all the data, wrote it down. At the end, we made the results, and then we called the Bemer guys, and then we said, how does it look like? And they had an envelope which they sealed before which was writing in that the group B was the functioning Bemer set. So it was really double blinded. This is also why I was okay to participate to the study, because I liked the setting. I'm a more scientific person. I like to be critical, and I was only okay with the study when I knew that it was double blinded.
Dr. Brandenberger, can you comment on what kind of measurements are in place during surgery? Because people are asking, how do you even know what kind of effect the anesthesia has, and whether the Bemer has an effect on that? How can you measure that? I know there's intensive measuring going on, but can you comment on that?
So we start in our clinic. So every clinic is different. In our clinic, we start before surgery. We take a blood sample. We measure the muscle values. We measure the total protein, and we measure the leukocytes, which are the white blood cells. The horse is then put in general anesthesia, is put on the table, and then he gets as I showed on the picture, invasive blood pressure measurement. This goes throughout the surgery. On the study, we measured it at 3 time points. During surgery, we take from this arteria, we take blood samples, and we analyze the blood gas values, which are arterial O2 pressure, arterial CO2 pressure, pH. And then we take venous blood to check the lactate also. The CK, which is the muscular enzyme, is measured. The horses goes back to the recovery stall. In the recovery stall, last blood measurement is taken, and when the horse is getting up again. This is here in Germany, we have to document a lot. Unfortunately, when you have an anesthesia problem, the owners, because the horses are also very expensive, the owners, they like to get into trouble with the vet and try to say that the anesthesia wasn't done in a nice way. So we have to document, and we can show them, look here, we have the blood pressure during the surgery, we have all the values from how much isoflurane he got, what's the CK, how was the total protein before surgery. This is the normal documentation we do, and we use just the same protocol for the study.
Dr. Brandenberger, how long does a typical surgery last? I think specifically in this study, and perhaps you have used the Bemer also in conjunction with other surgeries already that had a longer time period.
I like the question of the audience, so it shows that the audience is really into the topic. I like that a lot. So the equine surgery field is very broad. You have orthopedic surgery, you have colic surgery, you have, as I said, ophthalmologic surgery, larynx surgery, and every surgical type is very different. So I will just focus on the ophthalmologic surgery, that we used for the study, because this is always quite the same. So the horses, they have a time of 1 hour and 15 minutes from when they drop into general anesthesia, and then being put into the recovery box. It takes about 1 hour and 15 minutes. This is for horses or horse equine surgery quite a short general anesthesia. Sometimes, for example, for a colic surgery, it takes about 2 hours, 3 hours, 4 hours of general anesthesia. And this is also interesting for the future. we should, as we measured only on the very short anesthesia, the effects, we should also make a study on the longer surgeries. Unfortunately, the only difficulty is for these studies, and I want to say that just right now, for example, a colic surgery is never the same. Horses are completely different. They have different conditions. There's a small intestine problem, large intestine problem, there's stomach problems, just completely different. And this is difficult then to make a study. You have to have a huge field of horses to make a nice study. In the eye surgery, what we did, we have always the same condition, always the same problem, always the same team. This is why we could study it quite nicely. But I agree, it would be interesting to see the effects also on the scientifically in longer anesthesias. When I do longer anesthesia, so in our clinic, I perform the colic surgeries. We also use it in the recovery box, because during the colic surgery, there's a lot of water and fluid going around. It's difficult to put the nice Bemer blanket on the horse, but as soon as the horse is in the recovery, we put it on.
Dr. Brandenberger, is there a concern for increased bleeding during surgery, considering that the Bemer enhances microcirculation?
I have not seen that. And I can tell you that our ophthalmologic surgeon, Dr. Laser, who is performing the surgery, he is very keen not to have bleeding in the eye when he does the eye surgery, because as soon as there's blood, he cannot see anything at all. So, and he didn't complain about that as well. Yeah. This is the bleeding. Sorry, the bleeding is more also a surgeon, a problem of the surgeon. Sometimes when you cut on the wrong place, it's bleeding more.
This was actually a funny question. How could the Bemer blanket normally goes around the horse body when it's standing, and so the control box will be on the left side. Someone was asking, how can it be if the horse is laying on its left side, he still can get the Bemer blanket applied?
I should have made a video of how our vet who is doing the study, you just have to go under the horse and put it on. It's okay. It's working. Yeah. So he was crumbling down and activated it like that.
I also saw the picture of one of your pictures is actually more like the draping of the horse set on the horse body in lateral position, right?
So the top blankets, not the question, or I misunderstood. The top blankets, you can always get access to the small orange box, and the bottom blanket, you just have to put it as in a fashion that you can get access to the small orange box when you put the horse on it. So a little bit more in front, more to the shoulder, for example.
This is an interesting question, actually, from a veterinarian. Did you use anything to prevent the surgical team from exposure to the Bemer horse set signal? Which I actually think that's maybe beneficial for the surgeons having to go through a long surgery.
So we were asking the Bemer guys to get us one of these Bemer couches between surgeries to get to relax on. No, back to the question. Sorry. I think what I learned from Bemer, and maybe Dr. Burka can help me. I think the coil makes the signal going down from the coil to the inside and not to the outside. Anyway, it's not a bad signal, so I would be happy to get it. But I think the coil is made that it goes on the inside.
So just to comment on that, the coils they do emit bilateral fields, so from the inside to the out. However, ladies and gentlemen, it's important to remember physics law. Electromagnetic fields decrease exponentially with distance. So if you're even feet away, you'll have very little impact on the human body from the electromagnetic field. In addition, from the previous question, yes, the Bemer blanket is set up that they are coils around the nerve plexes. However, you can have very similar, if not the same effect by draping it over, because it's not just about the induction, the inductive field that is interacting, it's about the very specific signal that's supporting microcirculation by resuscitation of vasomotor function.
Dr. Brandenberger, these studies are still to be published and preliminary. Can you already say something about recommending? People are asking how the Bemer horse set could be used by the general public and vet clinics for surgeries, and equine hospitals, how they would do that. Is there already a quote unquote blanket recommendation you can give? And Dr. Brandenberger respond as well.
I think I did show how we use it now after the study. We use it before and during, and especially after the surgery. This is all I have experience with. I'm happy with that. I use it on the 3rd degree for 15 minutes on these horses. My nurses do this, and I didn't test anything else because I know with that it works. I don't have a special recommendation on anything else.
And I agree. I like before, during, after. One of the most beneficial times is post-surgery, because the focus is to resuscitate vasomotion from the impaired impact of the therapeutic, in this case, the anesthesia. And so you want to, after the half-life, is to try to bring that out, to bring the human or the horse out gently from being under.
Dr. Burka, maybe you can answer these 2 questions. There's a lot of questions about, will Bemer horse set help with XYZ condition, health, disease or condition? And also the question, how long does a session last in a healthy horse? Yeah,
so sessions are 5, 10, and 15 minutes. So in general, you could use level 3 all the time, but what I like to do is, if it depends on the time and it depends on the horse more specifically, and depends on what the intention is. Let's talk about these diseases quick, because regardless of the actual disease name, I don't care about that. And what I do care about is all functionality, both either physiologically or pathophysiologically, are directly related to functional blood flow, which is modulated or mediated by the nervous system, by the balance of the autonomic nervous system. And so this is where Bemer's sweet spot is keeping that horse in that active ready state and allowing them to move into either a run or a rest and digest state. And so keeping that fine line, and that's the aspect of wellness for a horse. And for many horses with tendencies to anxiety or gastrointestinal issues that may not be structural, but more functional because of stress, anxiety, that's where you can see this really shine.
Dr. Brandenberger, there's also a lot of questions coming in of people asking about performance horses. And I thought, since you mentioned you have 5 jumping horses, can you comment on how the use of the Bemer horse set has worked for you in your own horses?
Luckily, my wife is not sitting next to me, but she has a very difficult mare, which is quite, I like to say, hibbly or active before the show jumping show, and we put it on just to calm her down. That's one of the best things we do. My own horse has head shaking, unfortunately, and I use it once or twice a week, especially on the sunny days, to help him.
Can Dr. Brandenberger and or Dr. Burka, can you comment on how the Bemer helps, the Bemer horse set helps with injury recovery after surgery? Like, what is the mechanism?
I would love to study this. I would love to study this also on the wound healing. So this would be for me a future study that we should do, also again double-blinded, to see if the wound healing, or for example, when we do a lot of orthopedic surgeries where we remove the OCD chips from the articulations. If there's a better, faster wound healing, if the wound closes quicker, this would be interesting also to study, but I didn't study it yet.
Yeah, that's a great question, Dr. Vonk. And what I can say is this: I talked about self-regulation, auto-regulation. Many people think that the goal is to stop or to halt inflammation. And the truth is, inflammation is a very important part of the regeneration process. So the modulation of moving into the upregulation of inflammation and into the resolution phase is very, very important. Bemer does not suppress inflammation. Bemer supports the movement through that inflammatory process. So it's more pro-inflammatory to help with the resolution phase. Folds full circle into wound healing, because yes, there's different rates and rhythm of blood flow during different phases of wound care. And to get granular, Dr. Brandenberger, and really get in there and to see what type of tissue interactions with the nervous system, with the microvessels, that's key. And I certainly look forward to future research.
Dr. Brandenberger, first, someone would like to know if you speak French.
Yes, I do. My wife is actually from Belgium, so we speak French at home.
And also, if the Bemer cuffs can be used over the top of a medical bandage or standing wrap when dealing with injury recovery.
That's absolutely good question. And I asked the same to the Bemer guys, and they told me yes.
Yes, and we commonly do that also. It goes through the blanket, for that matter. Maybe you can comment to this. Are there any certain circumstances where you feel the high intensity setting should not be used? And then there is questions about the common digestive concerns in horses. Can you answer to that compliantly for the North American market?
So I'm a surgeon. And I'm a vet who is using Western medicine. And so I also use, for example, cortisone, which is a strong medication. And for me, I always apply it in the third setting because I want to have the biggest effect out of it. So I didn't try the other ones out of, in my experience. I know that people, maybe they should start with the smallest one and see what is the effect on their horses. What do you think, Joshua?
Yeah, Dr. Brandenberger, I agree with you. And you mentioned something very important, the combination of using, like, for instance, non-steroidal anti-inflammatories or true corticosteroids, which are suppressive type of therapeutics. Bemer is a pro-inflammatory type of thing. I said moving through the inflammatory process. When you're using corticosteroids and things of that nature, what can occur is that can halt that inflammatory process, which is the goal, but higher doses are generally needed when somebody or a horse is under the influence of either chronic use of corticosteroids. And so in those cases, I do use higher levels or recommend higher levels. Those horses that are more skittish or more jumpy, I generally will take to the lower levels with the lower outputs. But again, the maximum flux density output from the Bemer blanket is around 35 and 100 on the cuffs. Note, the geomagnetic field of the Earth is about 50 microtesla. So even at 100 microtesla, it's not very high whatsoever. A cell phone emits up to 5, 6, 700 microtesla. Again, it's not about just the induction, Faraday, that type of inductive capacity. It's also about the information that's being passed in the body to help support not just the local target tissue, but systemically as a whole for that equine user.
So I'm being told that the time of the webinar is unfortunately done, but we have so many questions. We definitely have not gotten by any means to the end, but I promise that everyone will get an answer because we do have a way of contacting you since you're registered with your email. So I'm going to pass it on to Dr. Burka to close. And thank you so much for answering this many questions.
Actually, I think that goes to you, Miranda, doesn't it?
Indeed, it sure does. That is me to wrap it up. Very sad. This has been an outstanding session. I mean, just unbelievable with the technical questions. You can really tell the engagement and interaction. Excellent, excellent. I would like to tell the audience as well that there will be, and there always will be, a recording available. So we will be posting that on our web handles. And there is also an archive where you can where it will be housed and where you'll be able to see all of the videos thus far. We're also going to be working with our marketing team to be sending out a push so that to make sure that everyone has the recording, which I know this has been an incredibly popular session. So I want to make sure that everyone is able to watch. So yeah, so thank you all so much. I will say Dr. Joshua Burka and Dr. Olivier Brandenberger, of course, who is joining us all the way in Europe. It is midnight. Well, no, it's actually like 1 a.m. his time. So thanks so much for staying up with us and delivering such an excellent presentation. And of course, I'll also say to Marlise, our excellent moderator, who did a fantastic job with the Q&A. So thank you. And I'd also like to say thank you to Bemer for your generous sponsorship of this session. And now to you, participants. Please join us next Thursday for more continued learning at 6 p.m. Eastern Standard Time for WEF Week 10. That session's title will be Blue Ribbon Wound Care, Vet Blue, a new way to manage infection and speed up wound healing, sponsored by Vet Blue. I also would like to say one more thing, that we do have your information. Every question that you have sent in, we have it linked to your email. We'll definitely be getting the answers to your questions. We've just been inundated with questions, and unfortunately not enough time. So sad. But you definitely plan to get a response directly from the Bemer team. Now, on that note, don't forget, of course, to register for next week directly on the PBIEC website to secure your spot and to count for one entry for the grand prize giveaway from Karina Brez Jewelry. And as well, we are very international, I will say good morning, good afternoon, good evening, or good night. Thank you all for joining, and hope to see you all next week. Goodbye, everyone.